I wanted to make a couple of, or at least start with one very broad observation on very dangerous ground, because I'm not really a disabilities expert, but I wanted to just toss out for the later discussion, and I hope we have, I'll cut myself short to make sure we have some audience time. There's some incredible expertise sitting in the audience here that we haven't tapped yet. But I feel as if we need to really look at subpopulations as we look at at some of the issues we're facing here, from housing structures to services to whatever, and that we, if we only look at it from through the lens of a specific population, 85-year-old frail elderly, we may come up with different optimization from looking at it from a 45-year-old person with physical disabilities. And we just need to, I think, as we write rules and develop programs and whatever, we have to constantly keep in mind that this isn't one population. That there are a number of subpopulations here, and I don't know what the implications of that would be running through all these items, but I do feel that that's something that needs to be on the table. I would also compliment Carol Galante and her team for what they've done with the Section 202 program and trying to reimagine it. They're not done yet, and there isn't any funding, but it's something that needed to be done, and sets the groundwork for what we all will hope will be some additional funding in the future, and potentially even some in a very limited amount in this year's appropriations bill. So I wanted to just make a couple of sort of cautionary comments from the lens of housing providers. One is I worry a lot about unfunded mandates. The old, I've forgotten who came up with that term. It might have been a political buzzword 30 years ago, but there's a real risk that HUD, housing finance agencies, and other subsidy providers will create scoring systems and develop programs that expect people to provide sets of services for which there's no funding. And so we really have to be very careful not to try to get ourselves to where we want to be through regulatory mandates without substance behind them. A second big caution, I think, is, and again, this is something that I would toss to the healthcare experts in the room, but I'm really worried that as we move down this track, we end up becoming a regulated, another regulated industry, so that the housing providers end up being enmeshed in HHS survey requirements and regulatory limits and staffing requirements and state licensing requirements, and we go down a track that takes away the residential character of what we're what we're doing and what works and what helps people lead lives they prefer, to a track where we become where the housing becomes quasi licensed assisted living or quasi nursing homes, and we end up not only not achieving the goals we want with respect to the people's quality of life and health, but also lose the cost savings that are clearly one of the drivers for looking at these issues. I also think we still need more demonstrations, and we need more efforts to develop models. We can put them under a single term, but the reality is they're going to be different from place to place and from population to population. We've been working with Leading Age for a couple of years around these issues, and are about to launch a learning collaborative where, instead of just having the housing providers and government officials in the room, we're going to each housing provider is going to have its healthcare partner in the room. So we'll be working with, say, 10 or a dozen organizations on a continuing basis, both to further develop the models that they've already begun to develop, but also to tease out the policy questions that trying to put those models together have kicked out or will kick out. Finally, I just wanted to sort of comment on the data question. I mean, I think we've all benefited from, and hardly anybody's been on a panel where Dennis Culhane's work has not been mentioned. But the reality is that for other populations, many other populations, we have only anecdotes. I'm embarrassed to say I haven't seen the app paper, but it'll be the first thing I do after I leave today. ASPE and HUD's policy office are jointly working to crosswalk data between the 202 records and the and Medicare and Medicaid records, I think for the first time. And the MacArthur Foundation is funding a team of which Leading Age is a part to dig deeper on some of those. So they've kind of begun the process. I always worry about evidence-based government because I feel as if we often that becomes an excuse for not making changes we know need to be made, changes we need to be made in the short term, but we also need to be looking at the long term and the sort of systematic data collection, and I think that the current HUD and HHS anyway have shown real interest in that and have begun that process. Finally, I just comment that our members along these lines are working to develop outcome measurements that can be that might not meet academic standards and might not constitute evidence-based government, but that if done consistently across a number of organizations would begin to build a data set about what difference supportive housing makes in the lives of the residents and the costs of providing the services. So with that, I'll pass it back